Prosthetic joint infection pathophysiology. The most common bacterial organisms responsible for prosthetic joint infections include Staphylococcus aureus, Staphylococcus epidermidis, and coagulase-negative Staphylococcus species, particularly in chronic infections. Candida species, such as Candida albicans, are the most common fungal pathogens involved in these infections. Prosthetic joint infection classification. Time of onset. Infections can be classified based on their time of onset. Acute infections occur within 3 to 6 weeks of surgery and are typically confined to the joint space without invasion into the prosthetic bone interface. Chronic infections develop more than 3 to 6 weeks after surgery and are characterized by the formation of a biofilm by bacteria on the implant, which makes eradication challenging. The biofilm is composed of 15% cells and 85% polysaccharide layer, which helps bacteria adhere to the prosthesis and protect them from the host immune system. Source of infection. Infections can arise through direct invasion, such as from a sinus tract into the joint capsule or wound dehiscence. Hematogenous infections can also occur, where an infection from another part of the body, for example dental work, infected gallbladder, spreads to a previously infection-free joint.